Hey everyone, it's Bob from ProMotion Physical Therapy. I just want to take a moment and talk to you about the topic of degenerative disc disease and how this may or may not relate to pain that you might be having in your low back or your neck. So a lot of the people that I see here in the clinic have had their low back pain or neck pain for quite a period of time, and most of them have already had an X-ray or an MRI done on their back. And one of the most common things that they tell me is that they've been diagnosed with degenerative disc disease and been told that this is the cause of their pain. The interesting thing with degenerative disc disease is that if we look at the studies in which they did MRIs and X-rays on people that do not have any symptoms, meaning they don't have any pain, we find that a high percentage of them have degenerative disc disease as well. In fact, if we look at individuals that are in the 20 to 30 range, up to 30% of these people will have degenerative disc changes in their lumbar spine. If you're over 50, that percentage goes all the way up to 80%. And if you're over 85 years old, if you're over 80 years old, the percent of people without pain that will have degenerative disc disease on their X-rays or MRIs goes all the way up to 96%. So when the prevalence of this is so high in people without symptoms, we have to start to question whether or not that's actually the cause of people's symptoms. So what I try to tell people is that the changes that we see in the spine as we get older are just a normal part of aging. When we look at our bodies from the outside, our skin is different. Color of our hair is different. We get gray hair, we get gray beards. Some of us lose our hair as we get older. And we wouldn't think that this is really abnormal, okay? So we don't look the same on the outside as we do on the inside. And just because somebody's hair is going gray, or in my case, going bald, we wouldn't expect me to have a headache, or somebody whose hair is going gray to have a headache. So the same thing happens on the inside of our body. As we age, our spines show some changes. And really, degenerative disc disease is just gray hairs on the inside. Okay, it's a normal part of aging and likely not related to the symptoms that you're having in a significant way. And in fact, what you need to know is that you can get out of pain without us ever changing the degenerative disc disease. In fact, we can't change it. It's there, but that doesn't mean that you have to have a pain. The more we learn about back pain or neck pain and pain in general, there's many factors that can be causing the pain, which a therapist who takes a holistic approach in managing your symptoms will be able to work through with you and identify some key things that may be contributing to your pain and help you get out of the pain cycle. So the message today is don't freak out about degenerative disc disease. Despite what you may have been told or may have learned on the internet, it's likely not a big factor in causing your symptoms, and you can get out of pain and get back to doing everything that you want, despite what is shown on your X-rays or MRIs. If you have any questions, feel free to contact me. If you need some help managing any neck pain or back pain and you've been diagnosed with degenerative disc disease, feel free to reach out and we can talk a little bit and see if there's some things that can be done to get you back to doing the things you want to do. Thanks.